COVID cases. This morning I'm training with my trainer, okay? And he says, who's on the podcast today? I said, Press Secretary Pushaw, Governor DeSantis is press secretary. He says, oh, really? I said, yeah. I said, let me ask you for you, what questions do you have? I said, do you know who she is? She says, no, I don't follow politics. I said, but what question do you have for DeSantis? He says, well, I want to know how he's going to handle this COVID breakout in the state of Florida, okay? Now, you got to realize there's people that follow stories, there's people that follow headlines, there's people that kind of see what the news says, and that's it, right, with COVID cases. Can you pull up where Florida ranks in number of cases, number of cases for, I don't know, let's do for period, ever. Go new cases all time right there. If you can make it a little bit bigger so the rest of us can see it. Okay, Florida, what is the number? Do they show the numbers? No, you got to do ranking. Go ranking. States. Go a little lower. There's a website right there. Go a little lower, little lower, little lower, little lower. By states. Okay, the one that says by state. Okay, just go up. Forget about Florida. Just type in COVID cases by state. Take Florida out. COVID cases by state. You got it. By state. All right, let's go there. Go a little lower. There should be a ranking. Lower, lower, lower. Right there. Click on that and see where Florida ranks.
Florida's going to be third because we're the third biggest population.
I totally get that. And yeah. I want to go to, what site would you say for him to go? Can you help him out to see what site to go to? There's a website that shows all of it. Oh, Data Tracker. That's the one. COVID Data Tracker. You just found it. Yeah, go to COVID Data Tracker. By state. Okay.
Yeah, the CDC has a lot of information.
Here we go. CDC, go to... Okay, anyway, so you're having a hard time finding it. Let me just ask you. So the questions with COVID cases. So the criticism people get, when I go to California, I'll go to New York, I'll go to Greenwich, I'll go to different left blue states, right? They'll say, where are you from? Florida. Oh my gosh, how are things there? Oh my gosh, it must be really bad over there. Is it pretty bad with COVID cases? I hear the hospitals are full. I hear it's just people are dying left and right. It's tragic what's going on in Florida. How are you protecting yourself? You would be amazed how many people have an interpretation of what they think is going on in Florida. So what would you say about the handling of COVID cases in Florida, and what are some data you can share with the audience?
I would say, number one, cases are not the most serious metric to be focused on, because a lot of cases, particularly among people who were vaccinated or people who are just in lower risk groups, the case might just be a positive test. You might not even be sick necessarily, or you might have like a slight cold or something. So what we've kind of focused on more is preventing hospitalizations. So helping the most vulnerable people who are actually vulnerable to severe outcomes. So if you look at the data, I mean, I think the most important data point to look at is deaths over time since the beginning of the pandemic. Why? Because obviously we want to save lives. So New York's deaths per capita is higher than Florida's, despite the fact that New York has so many restrictions and Florida does not, and our population is older than New York's on average. So we have a higher risk population. For all states, Florida is, I think, number 17 or 18 in terms of number of deaths, which is a little bit higher than average. But again, considering how old our population is, if you adjust for the age, it's lower. And considering the fact that so many of those states that are higher than us in deaths had these restrictions, I think it just goes to show you, like, there's no real, so that's a good chart. There's no real reason to say that these restrictions actually worked. And so I think that's the thing. I think when you're talking to people from other states who have heard this narrative in the media has pushed it because they don't want people to see that everything is fine in Florida and to see that we're actually doing better than a lot of the restrictive states and the mandate states. Why? Because for whatever reason, media supports the restrictions more.
Okay, go to, I just found it. Go to World, okay, I'm just going to send you this link. It's World Ometers.
That's a good one.
That's the one. If you go to World Ometers and go down and make it a little bit bigger so the audience can see, keep going down, down, down. Let's see if the states shows up. So when I'm looking at, I'm seeing the states. There we go. Okay, so by cases, go total cases. Make it bigger, make it bigger, make it bigger. Okay, so Florida is number 3. Okay, California's got 7.67 million. Texas got 6 million cases. Florida's got 5.395. So if that number is the way it is, Florida should also be ranked third in a number of people that have died due to COVID. So can you go to total deaths that we've had? Go to total deaths, and let's see where it ranks there.
It is, yeah.
Okay, so it's third as well.
no,
It really should be total deaths by 100,000 people.
That's
Right,
per
per
capita.
capita.
So that's
Yeah,
how
exactly.
we
So
look
per
at it.
capita, it's ranked 17th or 18th.
Wow.
We,
Yeah.
We've been
Yeah.
literally middle of the pack the entire pandemic.
So then here's a question. Because
Go to that link I just sent you, Tyler. There's another good stat
because
you should take a look at.
if a Nikki who's running for governor is talking about how DeSantis is running this place like a dictator, okay, and you have Newsom and you have Cuomo, you have New York, you have Illinois, who everything's been mandate. How is it that Florida's number of deaths, knowing this is a retirement state, this is where people come to Panama City to retire.
Yeah.
People come to Palm Beach. People come to places like that to
villages.
retire. Yeah, the villages. So why do you think, what were some things DeSantis did or the state of Florida did where the death per capita isn't third place, where the number of cases is third place for Florida?
I mean, it's a great question. I think number one, all of these restrictions that were trotted out, like from the lockdowns to the vaccine mandates, mask mandates, none of that stuff was proven to work. This is the first, like we've had pandemics before in our lifetimes, the last one being H1N1 in the 2000s, and nobody ever talked about a mask mandate. Like it wasn't on the radar. And so like, for whatever reason, all these new things were introduced in the last couple of years with COVID, but they haven't made a difference. Now, as far as what DeSantis has actually done, though, he has focused on, well, one, he reads the research. He talks to different doctors like Jay Bhattacharya from Stanford, Martin Kulldorff from Harvard, like doctors who know their stuff, but they have a little bit of a different perspective from the overarching narrative. And also, if you know our Surgeon General, Dr. Joseph Ladapo, he just recently joined from UCLA, brilliant guy, Harvard, MD, PhD, and he has said the same thing. The restrictions haven't worked. We should be focusing on overall health of the population and taking care of the people that actually are vulnerable to serious outcomes. Statistically, that's older people. So Governor DeSantis, when the vaccines became available, prioritized seniors, 65 and older. The CDC was saying you should prioritize frontline workers, but that could be 20-year-olds. And he's like, well, they're not at as much risk, and that's just a fact. So we're giving it to seniors. CDC later updated its guidelines. Next thing, he promoted treatments and still does. Monoclonal antibody treatments saved thousands of lives. When the Delta surge was hitting Florida very hard in summer, I think Governor DeSantis really pioneered that, like opening all the state treatment sites, 25 sites around the state where you can make an appointment as soon as you test positive, go and get the treatment, no prescription needed. And it kept a lot of folks out of the hospital. So they would have had to go to the hospital if they wouldn't have gotten that outpatient treatment. But they didn't have to, thanks to this. And so now other states are doing it. The Biden administration has not supported this. They actually just yesterday pulled 2 of the monoclonal antibodies off the market without showing us the data, saying that they say it's not effective against Omicron, but they haven't shown us any data on that. So it's very weird. But yeah, that's where the governors stood apart. I think that's why our death rate is lower than many of these lockdown states like New York, for example, or New Jersey or Rhode Island, because we have focused on protecting the vulnerable and focused on treatment.
So if you enjoyed this little short segment from the podcast that we did, here's another short segment to watch. Or if you want to see the entire podcast, click over here. Take care, everybody. Bye-bye.